I'm Dr. Ridgley. Like Hillary said, I am talking about nutrition. This is just so you guys have a little bit of background on me. I work at Skyridge Primary Care in the Lone Tree office. I'm board certified in both internal medicine and neuromuscular medicine, which I have done for a while now. And then I just recently was board certified in integrative medicine, which, nutrition is one of my passions. So I chose to do a talk on nutrition because I think that when we're living our healthiest life, it's very important to start with a foundation so that we can move forward from there. And then the follow-up series will have a lot of other more specific topics that regard continuing to improve our health and well-being. And I will definitely leave some time at the end for you guys to answer or ask questions if you guys have any. There we go. I do not have any disclosures. So let's start with what is the most common diet that we have today. That is the standard American diet. And most people, to some degree, eat this diet because it's easy. And a lot of us have been raised on this diet because it kind of got started in the late 70s and 80s with the fast food. And it's something that we know. And a lot of times when we're in habits, it's hard to break those habits. So going to kind of point out what is in the standard American diet, which in kind of the integrative and functional medicine world, we call it the SAD diet. It's very high in carbohydrates. So that is one of the things. And carbohydrates, sometimes we hear, bad things about carbohydrates, kind of like we have in the past about fats. But the reality is carbohydrates are necessary and they're very important. But the problem with it is that a lot of the carbohydrates in the standard American diet are very simple and they don't really support our body the way that they should. It is not nutritionally dense. And it has a lot of processed foods. So things that come out of a box, which, and a lot of times makes things a lot easier. But it definitely is something that we have to consider whether the processed food is really worth the effort we're putting into it. And then we have fast foods. I think most people know the harms of fast food these days, and enough that a lot of the fast food chains are trying to provide healthier options, but some of those things it's easier to choose the yummier options than the healthier options. But fast foods are definitely part of that. The standard American diet is very high in sodium. At this point, sodium, the recommended amount of sodium is around 2,000 milligrams or less of sodium. If anybody on here is on a low sodium diet, you guys know that. And the standard American diet, and most people get around 5,000 or more grams or milligrams of sodium per day. It's very high in trans fats, and we're going to talk a little bit more about fats when we get further along. But trans fats are probably one of the worst fats that we can have, and trans fats means that a fat was cooked and then actually changes its chemical nature, and the body really doesn't know what to do with it. So when we cook fats in high amounts of heat, then that can actually happen. And when we're looking at fast foods and a lot of the processed foods, they have trans fats in them, and it's probably one of the more inflammatory things that we can have in our diet. Another thing is artificial dyes and artificial ingredients and things that we are not as aware of. And it's interesting, like for example, aspartame. I can give you a lot of bad things about aspartame, but what's funny is that they've even started to call it different things to kind of hide that name of aspartame, to be able to use it, such as amino sweet and a few other things. So MSG is a similar one. MSG is used a lot in fast foods. It's also used, it's one of the ingredients that some chains and pizzas will actually put on there. They call it fairy dust because it makes you want more sweets. So then they end up selling more soda. So MSG is definitely one of those things that also has multiple names that is important to stay away from. A couple other things that we're going to get further into and why they're important is that the standard American diet is low in fiber. And we'll talk all about in a couple of slides about why fiber is important, and low in omega-3s. But just in general, the Standard American diet is very low in nutrition. So that's why it's better for us to kind of focus on a more anti-inflammatory diet, which we talk about now. So kind of in comparing the two, the anti-inflammatory diet is very whole food based. So that does require more cooking, but there's also ways to kind of get around that by eating more raw fruits and vegetables and things of that nature. Then it's also very high in omega-3 fatty acids, which we will talk a lot about today and why they are important, and where we can find them. It's also very high in healthy fats, and that is something that I want to kind of dispel a myth on, because many of us grew up thinking that fats were bad and they caused cardiovascular disease. But the reality is that many of the fats that we have in our diet that can be very good for us and very healthy. So kind of knowing the difference between those is very important. One of the things that I struggle with sometimes with my patients is protein amounts, and that one gets to be a little bit of a catch-22, because we hear about how vegetarian diets are really important from a cancer perspective, but then again, when we do a vegetarian diet, I have many vegetarians who don't get enough protein, and being low in protein can create problems too. So it's important to know where you can get proteins, not just from the animal source, and it's also important to know how much protein that you need. So, and then talking about healthy carbohydrates, I really want to kind of change that idea that's kind of come up lately, that carbohydrates are bad for you, because carbohydrates are our fuel and we do need them. And it's important to make sure that we're giving ourselves the appropriate fuel, that clean fuel and not that dirty fuel. So from an anti-inflammatory diet, there has been many, many studies done, and pretty much every study has been found to be helpful in the chronic diseases that are tested. Even some of the kind of lesser known chronic diseases, but everything from autoimmune to cancer to cardiovascular, type 2 diabetes, type 1 diabetes even, we can't really change the type 1 diabetes, but eating a healthy diet makes a difference in the health. So some examples of that is the Mediterranean diet, the Okinawan diet, the Paleo diet, and the DASH2 diet. Mediterranean is probably the most commonly known. All right, so let's get started. My favorite topic, went up ahead a little bit. Water requirements. Water is extremely important. It is the detergent of our body. And just like we need to clean our house, and we need to clean our cars, and we need to clean our clothes, we also need to clean our body. And that is what water is for. It hydrates us. It allows our immune system to function properly, because our lymphatic system, if we're chronically dehydrated, cannot flow properly. It also has other implications, which I'll get into. So what are our requirements? So in adults and teenagers, the recommendation is between 64 to 88 ounces. That's going to be 8 to 11 cups. Obviously, if you're, just naturally on the larger side, like some of our guys who are 6 foot, and some of our girls sometimes too, then, obviously that we're going to need more water requirements. And so that you'd be up more into the 11 or 12 than the 8 or 9. Our preteens, so when we talk about preteens, we're talking like 10 to 12, 9 to 12 age range. That's going to be 7 to 8 cups per day. Children, so 8 and below is about 4 to 8, and then our toddlers are 2 to 4. I do like to make a comment about water, because people are like, water. Water is, when I mean water requirements, I'm really talking anything that does not have caffeine in it. And even some things that have some small amounts of caffeine, like green tea, can be really healthy for you. Or decaf coffee. You can sweeten it with like electrolyte powders and things of that nature. Do not recommend anything that's high in sugar, and I don't really recommend things that have artificial sweeteners in it, but there are definitely some out there. My particular favorite for helping with my water is Ultima. Just the one that I like, but there's a lot of them out there. So it does not have to be pure water. You can change it. You can put lemon in it. You can actually do uncaffeinated teas. And all of that counts as water requirements. So let's talk a little bit about why water is so important. So underneath in the smaller print, this is where I got the information. So there was this study done of 35,500 adults in the US, and they found that there is an increase in all-cause mortality. So what does that mean? That means that any type of chronic illness that was out there, if the person was dehydrated, they had more of a likelihood to pass away or die than if they were hydrated. So I think that's kind of a big statement. And if they drank enough water and they had higher water intake within reason, because there's also too much water, but good water intake, then their all-cause mortality went down. Another study showed that hydration was linked to diabetes and cardiovascular disease. And the way they did this one was really interesting. So if you're dehydrated, there's this hormone that goes up that's called vasopressin. And so they found that people with higher amounts of vasopressin in their system could predict whether they actually had or would develop type 2 diabetes, metabolic syndrome, cardiovascular disease, and premature mortality, which is kind of goes back to that other study that we talked about. They did not show in this study that if you increased water intake that it would change that. But what they did show is that in some animal studies that if they increased the water intake, that it actually did ameliorate the possibility. So the good part of that is that you can change and start to drink more water and start to feel better and have less likely to develop other chronic diseases. So the last one that I wanted to share with you, because microbiome is this buzzword these days for a lot of people. We have this healthy gut or not healthy gut, and we have a bunch of bacteria that are very helpful to us or not helpful to us. It's called our gut microbiome. And in the HydroGut study, they actually showed that hydration affects whether you have those helpful bacteria or that not helpful bacteria in your system and how it can affect your health. With the assumption, I'm going to say assumption because they didn't actually go to the point of actually saying that because the good gut microbiome bacteria actually is very important in your immune system, that it improved immune system function as well as decreased inflammation by staying hydrated because it actually changes the gut microbiome in a healthy way. So very important to drink enough water. All right. So getting to fiber. Fiber is another one that honestly, I mean, we've known about fiber for a long time. It's not something that is new. I think the first time it kind of came out in the medical community that fiber was really important was actually back in the 1920s. But as time has gone on, we've decreased our fiber more and more over time, and we don't get enough fiber overall. So the average adult in the United States, and I would put that to teenagers and kids probably, is they get less than about 15 grams of fiber every day. And fiber is just not optional when it comes to a healthy diet. So when we're talking about requirements, 9 years older, we're looking at 25 to 35 grams per day, and that is including preteens, teens, and adults. 4 to 8 is about 25 grams per day, and 1 to 3 is about 19 grams per day. So how does that kind of come out in the diet? A lot of people think that fiber comes from grains because that's kind of how we grew up. And the reality is grains are actually a very inefficient way to get your fiber. And one of the things I like to state about grains, although I like grains, most people do like grains, is that our genetic code has not really changed that much in about 20,000 years. And grains didn't actually kind of come up in our life until about 10,000 years ago. So in reality, grains are not absolutely necessary, but they do make some things pretty pleasant. So you kind of have to look at what you're eating and focus more on the whole grains when you're doing that. But when it comes to fiber, the place that you're really looking for this is through your fruits and vegetables. So it kind of varies. About one serving of a fruit or vegetable will give you about 4 grams of fiber. Especially your berries. Your berries are very high and very high in fiber and low in sugar. They're one of my favorites. They have about 4 grams per half a cup, which really isn't that much when we think about it. So talking about serving sizes, we're looking at half a cup is most things that are cooked or berries, 1 fruit if it's just a piece of fruit, a handful of lettuce if it's a lettuce. Let me think what else. Beans, a half a cup of beans is also a serving, and a 4th cup of nuts. So beans and nuts are included in that, and some people don't recognize that. So what are some things that fiber can help us with? Hold on a second. There we go. Oh, that went too far. All right. So high fiber diet. The study that I did get this from does have it's a study that been a bunch of other studies. So it does have a lot of information from other studies if you wanted to look at this. A high fiber diet, I think most people know this, helps with constipation and gut motility. So that's really important when we are having issues. And probably the number one thing for constipation that I recommend is a high fiber diet and water. It also helps with insulin sensitivity. So for our type 2 diabetics out there, it's really important to help decrease that insulin resistance and help our body respond better to the insulin that we do have available to us. It also can help to decrease the type 2 diabetes for the same reason. It helps to increase our gut microbiome. So we were talking about that gut microbiome back in the water. It helps increase the diversity, which has many, many health effects, which I do plan on talking about further in other talks about this series, but we're not going to get into it today. So it decreases cardiac risk, which I think a lot of people have that on our mind these days. It also diminishes the effects of depression, and that one I think is probably surprising to many people. It has a lot to do with the gut microbiome and having that diversity, which does have this gut-brain axis that we have discovered, and how it affects mood disorders and things of that nature. So very important. It does decrease the risk of colorectal cancer. There is still a genetic predisposition to colorectal cancer, and they actually haven't proven that it can diminish the development of polyps. But in the whole scientific realm, it has been shown to decrease the risk of developing colorectal cancer. And overall, it improves inflammation, which is a big part of every chronic disease out there, is how our genetic code takes inflammation and turns it into something else. And one person may take inflammation and turn it into cardiac disease, and another person might develop type 2 diabetes, and another person might have an autoimmune disease. So inflammation is a big topic, and fiber helps with that. All right, macronutrients. So we're going to get into proteins, fats, and carbohydrates. I'm going to spend probably the most time on the fats, but I do want to talk about the proteins. So let's talk about kind of what do these things do in our body. So I talk about proteins as being that foundation of our body, that which everything stands upon. We cannot have our body as it is without good protein. Proteins plus fats create the structure of the body, and also fats are a large part of what feeds the brain. So it's very important to have the protein and the fats in our diet in appropriate amounts. Lastly, the carbohydrates. Carbohydrates are electricity. As any car cannot run without fuel, we cannot really run very well without carbohydrates to some degree. But there is definitely a difference between those good carbohydrates and those bad carbohydrates. So let's talk about protein first. About 1 in 3 individuals are not getting enough protein. And I can honestly say that I've had situations where I have somebody who's starting to show certain types of disease, and we think it has to do with certain parts of the diet, and it did. but we thought it had to do with like eating too much sugar, not eating enough fiber, which is a pretty common one. And when we really looked into it, this person was eating more than enough fiber. They were eating very low sugar. They were really focusing on good fats, but what they were not getting enough of was the protein. And so we really kind of narrowed down the problem to the fact that he was not getting enough protein. So it's very important to make sure that we're getting enough protein as well. And so what is enough protein? And it's about 1 gram per kilogram ideal body weight. And that's a lot of math. For some people, it is for me most days. The kilogram per body weight. So if you get about 150-pound person, that's about a 70 kilogram person. That's a good equivalent. And it's about 1 gram per kilogram is what you would want for most individuals. Now, if you're talking about young athletes or somebody who has higher amounts of exercise, to moderate to high intensity, you're going to want to increase that amount to 1.25 to 1.5 grams per kilogram. So if we take that 70 kilogram person who's doing some mild exercise, you know, up to that 150 minutes of walking per week, then you're going to look at about needing 70 grams of kilograms per, or 70 grams per day of protein. If you're talking somebody who's doing some running consistently, especially doing resistance training, then you're going to want to increase that. And then you would be looking at doing between 90 to 120 grams per day, which can be a lot, but if you are training to that degree, it's very important to make sure you're getting that. So where can we get protein? Of course, most people know animal protein, but that's not the only place that we can get it. We actually have things like protein shakes now, which I don't always recommend, but eggs are a really good one to get the protein. You get about 7 grams, depending on the size of the egg, about 7 grams per egg. And one thing that I like to dispel the myth on is that eggs have not been shown to increase cholesterol like we were told for many years. They have not actually found that to be true. Yogurts, dairies, that kind of thing does have it, but so do all of your beans and your lentils. So your chickpeas, your quinoa, even rice and beans have it. That's considered a complete protein because it has all of the amino acids and that are required for our body. So those can also be found. Then of course there's the animal proteins, and when I talk about animal proteins, one of the big things I like to say is that not all animal proteins are created equal. Your grain-fed beef has been found to increase cholesterol, but your grass-fed beef has not actually been found to increase it. Your, so chicken, you want pasture-raised chicken. Same thing with turkey. So you want them to be fed the things that they should be fed, not to be fed something that isn't typical to their diet. All right, so talking about fats. We have good fats and bad fats. We have the omega-3 fatty acids, which are super important, and I'm going to spend a little bit more time talking about that. But we also have polyunsaturated fatty acids from other plants as well, like your nuts. So your plant fats like olive oil. Olive oil is a staple in the Mediterranean diet. It's very, very important to get enough of your polyunsaturated fats in your medium chain triglycerides. Medium chain triglycerides, if anybody's on the keto diet, is pretty familiar with that. You have your coconut oils that you can use from that perspective. The bad fats are really your overcooked or processed animal meats, animal fats. So your bacon, your sausage, anything that is cooked too much, like barbecue. And I love my barbecue. I'm from Missouri, but I love it. But at the same time, if you overcook the fat, it is going to turn and become something that isn't quite healthy for you, and it become more inflammatory. All right, so talking about good fats, we talked a little bit about that. The olive oil, your avocado is great. Nuts are amazing. Your omega-3 fatty acids, we're going to delve into that a little bit more, but coconut is also healthy. Your bad fats are going to be your other vegetable fats, such as corn oil, safflower oil, those kinds of things. That vegetable oils in general can have more of a tendency to be cooked and turned into trans fats, which is why those can be less healthy. Also, your margarine, which is essentially a trans fat. Butter is actually healthier than margarine. Your beefs that are overcooked, and then some of the other meats that we were talking about. All right, talking about omega-3 fatty acids, it is an essential nutrient and it must be ingested. Your alpha-linoleic acid, which is one type of omega-3, is from plant fats. And you're going to get those from your nuts and some of the other things. Your EPA, which is the eicosapentaenoic acid, and your DHA, which is decohexanoic acid, is found mostly from your meats, mainly fish. You can also get it from algae, but these must be ingested. So there was this myth that if we ate enough alpha-linoleic acid that it could change into EPA and DHA. And the reality is that ALA only turns, in our bodies, in humans, only turns to EPA about 5% of the time, and only about 1% of EPA turns into DHA. So this is an essential nutrient, meaning it must be ingested. And in the United States, people eat around 20 omega-6 to 1 omega-3. Now, so omega-6 has gotten a bad rap because of that, because eating an imbalanced amount of omega-6 to omega-3 can cause a lot of inflammation. So that's 20 to 1, and the ratio should actually be 1 to 1. So omega-6 are essential too. It just needs to be in a more balanced fashion. So, and talking about the EPA and DHA, I do like to also talk about this. A lot of times people think that you basically get it from fish oil, or fish oil, and which is the place that you can get it the most. And the what I would say probably the highest amount per serving. You can still get it in wild meats. You can also get it in grass-fed beef, and you can also get it in pasture-raised chicken, especially if they're fed flaxseed. All right, so let's talk about omega-3 fatty acids. I kind of wrote some notes on this one because I wanted to make sure that I talked about all the different things. I think one of the biggest one, and why I put it at the top, is it reduces all the risk for cardiovascular disease. So it can decrease the risk of myocardial infarction, heart disease, and vascular disease, and it decreases all-cause mortality for all of that. Now, the study that did this, it showed that it was a linear amount. The higher amount of omega-3s that you got, the more your risk reduction was, and it kind of decreased as the other one increased. And the problem with a lot of the studies for that is that the range on the studies have not all been the same, and so it's hard to kind of compare. They do say that the range was about 376 milligrams all the way up to 4,000 milligrams per day. And when looking at the studies, it did seem like the amount that seemed to be the most helpful, or where it started to become helpful and kind of increase, was around 2,000 milligrams per day. So that is definitely something that I think all of us have on our minds, and I think is very important. It also helps with mood disorders. And this is something that has been known for a while. One thing that they can say about mood disorders with omega-3 fatty acids is that there's a lot of data out there, and it's kind of mixed, but the overall has been in favor of it in helping depression, anxiety, and a lot of other things, because basically what an omega-3 fatty acid is that it is part of the cellular lining. And so single cell in your body uses it, and especially the brain. So it really helps with helping mood disorders. They do say that if you have bipolar, that they recommend doing it under the help of a psychiatrist, because getting more omega-3 fatty acids has a tendency to increase the potential for mania. And it has nothing to do with the interactions between the medications, and more to do with the fact that it may actually start providing certain things and kind of cause the medications to overstimulate. So that's just something to know about the bipolar. Omega-3 fatty acids do transport through the blood-brain barrier, so that is not something that is good. Not everything does. It decreases inflammation as a whole. It decreases inflammation, which is one of the things that has been attached to mood disorders as a problem. Most of the studies for omega-3 fatty acids have been done with EPA, that long word that I told you earlier, that is the majority. They recommended 2 grams per day with 60% of it as an EPA in most of the studies. So let's talk about child development. It is imperative in children and for child development, and that, you know, we absolutely insist that our pregnant patients have a prenatal vitamin, but it hasn't been until recently that we've actually started to jump on board with the omega-3s. So it's important to kind of know what the omega-3s do. When a person is pregnant or breastfeeding, they have found that increased amount of omega-3s showed increased IQ when the child was 4 years old. And the reason why they included breastfeeding in that is because if you're not finding a way to give them omega-3s, either through formula, then they don't really get it unless you're taking it and you're breastfeeding. But they did find that the more helpful omega-3 was actually DHA in this study. There's still a recommendation of 60 to 40 for DHA, but making sure that you're getting enough DHA, because that was the one that seemed the most correlated. It also has been found to decrease incidence of cerebral palsy, ADHD, and autism in patients or in children with mothers who have had omega-3s during pregnancy. And they recommend starting the omega-3s in the first trimester of pregnancy. Something that was interesting with that study is that it was a combo of DHA. Well, so they did just DHA, and they did DHA plus N-acetylcysteine, which is not something I'm going to go into, but that is also something that our body does make, but sometimes because of various reasons, including depleted nutrients, we don't make enough of. And they did find that the combo of DHA and the N-acetylcysteine did seem to help the most with that, but the DHA was very important in decreasing those incidents. So talking about the eyes, the thing that has been found about eyes is that the retina is very dependent on polyunsaturated fatty acids of the omega-3 type, mainly the DHA and the EPA. So the DHA provides the structural lipids of the retina for the photoreceptors, and the EPA has been shown to decrease all disease-related retinal neovascularization. What does that mean? That's a lot of words, right? So neovascularization means that vessels kind of go into that retina and they start to block it. You don't really want that. So EPA is found to decrease that. So there's a protective role in the eye for really any disease of the retina, but one of the biggest things that they found is for macular degeneration and ischemia of the retina or any age-related pathology. But if you have, and they have from a macular degeneration, they have found that it can be helpful, but prevention is probably the biggest key here. And so if anybody's done the 23andMe and it said that you had that genes, it'd be a good idea to get on that. From an autoimmune perspective, it has been found to help mainly the studies that I've seen have been in rheumatoid arthritis, psoriasis, and lupus. In rheumatoid arthritis, they did a test where they did just regular treatment with omega-3s, or regular treatment with olive oil. And they found that the omega-3s had a very significant reduction in joint pain, increased hand grip, decreased morning stiffness, and improvement in fatigue for patients with rheumatoid arthritis. In psoriasis, it's helped to decrease scalp lesions, erythema, scaling, itchiness, and it did seem to enhance treatment. For lupus, it decreased the activity of lupus, and they did this study with placebo and copper. So it was one person was getting placebo, one person was getting omega-3, and one person was getting copper. And they found that omega-3s decreased the incidence significantly between those. And then the last one, which is also a big one that a lot of us talk about it because none of us really want to get dementia in old age. It does decrease the risk of dementia along with, and so I'm going to give a few other vitamins here. Vitamins such as vitamins B, E, C, and D. There's obviously many B vitamins, so all of those were part of it. But E and D are fat-soluble vitamins. And vitamin C has been found to be helpful in many different things. And for the risk of Alzheimer's, it was DHA, and it was mostly if it was given prophylactically. So meaning that if you start taking it before or at the very beginning stages of the findings. All right, so I'm gonna kind of hold here on this slide just in case anybody does want to look at that. There will be the video will be posted. So if you wanted to go back to this page and actually look up some of these things because you wanted a little bit more information, you can definitely get that. And that's for any of the things that I posted here. But omega-3 fatty acids are super important, and I don't think they get enough, we don't get enough information about that. So. All right, so let's talk a little bit about carbohydrates. And with carbohydrates, I wanted to talk about the good and the bad and the ugly. When we talk about sugars, any sugars in fruits are not the same as sugars in that we get this added sugars. So added sugars are probably the biggest problem, or simple carbs. And so when we talk about simple carbs, we're talking about refined carbs. We're talking about white flour, white rice, white potatoes, especially if they're cut up and fried. So anything like that can be, they're simple and they break down quickly in the body, and they cause us an increase in our insulin levels, and they put a lot of pressure on our pancreas. So when we're talking about those need to be limited. Those are the things that are not so good, bad, and ugly. When I talk about added sugars, I recommend less than 40 grams per day of added sugars. Now, when we're talking about fruits, I don't really add fruits into this because there's a lot of health benefits from fruits that supersede some of the sugars. Now, your tropical fruits have a little higher amount, and I do recommend from a person dealing with prediabetes or diabetes to limit some of the fruits with the higher amounts of sugars and not as much fiber. And when we talk about that, I think if you go kind of down the list, the berries are probably your best from that perspective, and then your citrus fruits, and then your apples and peaches, and then your tropical fruits. They're probably kind of that line. So I don't really recommend tropical fruits every day if you're struggling with insulin resistance, but at the same time, they have a lot of really good things, and so I don't ever tell people to take them out of the diet. And we'll get into other aspects of that in a second. So when it comes to grains, I think I said earlier that grains are not absolutely necessary, but grains are nice. And I don't recommend cereals for breakfast. I recommend something that has all of your macronutrients for breakfast. But if you're going to do grains, you need to do whole grains, because whole grains do have some benefit from a nutrient perspective. They just don't have a lot of fiber, or as much fiber as the fruits and vegetables. So 70% of your carbohydrates should come from fruits and vegetables, if not more, if not all. Moderation in a diet for carbohydrates is going to be about 30 to 40% of carbohydrates. And since we're kind of at this point, I'm going to talk about glycemic load and index, but since I just mentioned the 30 to 40%, something that you can kind of, when you look at like how many calories that you need in a day, you can look at that and say about 25 to 30% is going to be your protein, and about 30 to 40% for both your fats and your carbohydrates. But when we're talking about that 30 to 40%, they have to be those good fats and those good carbohydrates. So when it comes to working out, so if you're an athlete, it is essential that you use carbohydrates for this. I have had people use keto and do pretty well overall, but most athletes do better, especially if you do higher amounts of resistance training or longer amounts of cardiovascular exercise, to make sure that you're getting those carbohydrates that you need. So last thing I wanted to talk about was glycemic load versus glycemic index. The glycemic load, well, most people are familiar with glycemic index, and that's something that they have used and said, okay, well, now I can't eat most of my fruits because they're high on the glycemic index. And so I've had to go back and show many of my patients who are concerned about this, or my pre-diabetics and diabetics, that the glycemic load is very different. So glycemic index is how many sugars you find in something that is food. Glycemic load is how that sugars actually breaks down in the body. So where something could be higher in a glycemic index, it can be lower in glycemic load. So for example, And I couldn't find a more complete one, which is kind of too bad. But like yogurt, low-fat yogurt is considered to be a 38 on glycemic index, but it actually, hold on here. Yeah, it's actually a little higher in glycemic load. So that's something that you might want to do a little less of, even though a lot of people say, well, it's got protein and fats in it. I recommend doing the no added sugar type and adding fruits and to that to help sweeten it. Um, Talking about like pizza, it's actually low on the glycemic index, but when you look at the glycemic load, it is not something that you probably should be eating. Or let's look at, let's see here. Um, Something that is like sugar actually is very high, but the breakdown is a little bit lower. So it kind of depends. And I don't really recommend a lot of sugar. Remember, we were talking about 40 grams per day. And then we talk about watermelon, which a lot of my diabetics are like, I can't have any watermelon that's really high in sugars, and I've seen it. And in this glycemic index, it's a 72, and that seems pretty scary. But when you look at the glycemic load, it's an 8, and it's in the green. So the way it breaks down and the way the fiber affects it does really change how that is affected. Popcorn is another one that's high on the glycemic index, but low in the glycemic load. So I tell most of my patients who are concerned about the carbohydrates to really focus on glycemic load of a food and utilize that from something they go for. So, all right. So, general rules. Everything in moderation. So, everybody likes to have a little bit of dessert from time to time. My recommendation is to have it from time to time, and my rule is no more than once a week to have something like a dessert or something of that nature. And even fats. I mean, we can overdo fats, we can overdo carbs, we can overdo all of it. So everything in that appropriate kind of level. And then eat until you're about 3/4 full. That is something that I struggle with, and I know a lot of people do struggle with, but making sure that you're not filling yourself up to the point where you feel full means that you're probably, if you are full, then you're probably overeating. And if you're about 3/4 full, then you're probably not overeating. Stay hydrated. And we talked about all the reasons to stay hydrated. And for normal adults, it's 8 to 11 cups of water. If it is in a commercial or a box, think twice before buying it. So I definitely cannot say that I don't use some things that are boxed. There's just some things that makes it a little bit easier. However, but I definitely think that this is a very important rule to shop the perimeter and look at things in the inside of the perimeter that may or may not be really worth buying. Like where could you use the money the most when it comes to eating from, a healthy standpoint, which is mostly whole foods. Shop the perimeter, which we talked about, because the perimeter is really the majority of all the healthy things. Also, farm to table is always best, but it's not always possible, and I get that. So one of the things that I like to point out from that perspective is I really like the EWG. They have the Dirty Dozen and the Clean 15. And if there is a fruit or vegetable on the Dirty Dozen, I highly recommend using organic or buying organic. Whereas if it's in the Clean 15, you don't really need to worry about it. And then for optimal nutrition, it needs to be you need to have a whole food based diet, a whole food based diet. And I do recommend a multivitamin. And the reason that I recommend this is because when we talk about our genetics being 20,000 years ago, those people, for the most part, had put out about 4,000 to 5,000 calories per day, and they were eating a lot more calories at that time. And in those calories, because we didn't have a lot of processed food, there's a lot more nutrition. So when it comes to our nutrition, we have the recommended daily allowance, and the recommended daily allowance is that which, if you go under that and you become deficient, you will start to have subacute deficiency issues. Now, the recommended daily allowance is not your optimal nutrition. I mean, it's not your optimal amount of nutrients. So I do recommend a whole food-based vitamin, because a whole food-based vitamin is bound in ways that the body recognizes as food, so you will absorb it better. So that's what I recommend for that. All right, so avocado saying, I said you're the good kind of fat. I love avocados. Thank you for all of your time and attention, and I hope that this has been useful for you. This is my contact information for the Skyridge Primary Care at Lone Tree. And if anybody has any questions, I'd be happy to answer them.
Thank you. That was wonderful. That was such great information. We do have a couple questions. I'll go ahead and ask a few that came in, and then I will open it up if anybody would like to unmute themselves and ask a question. So first question, does carbonated water have the same hydration impact?
So that's a really good question. I actually was looking that up at one point because there was this myth that carbonated water actually decreases phosphorus, which is never found to be true. So it can be used for hydration.
Okay. So you briefly just touched on this. It's a two-part question. Are dietary supplements necessary to be healthy? What should I look for in a multivitamin or stay away from?
So, yeah, I did touch a little bit. So I like the whole food-based vitamins. I don't subscribe to any particular one. I use New Chapter. I just like New Chapter. I've used it for a long time. Garden of Life is a decent one. Those are easy to find. You can find them on Amazon. And I do like both of those. Costco, I actually trust Costco to some degree, and they do have a Kirkland brand whole food organic based vitamin. So I think that could be a good one, but I haven't really looked at the back to see exactly what's in it. So those are some vitamins. There's some really, really good vitamins out there, and there's some good vitamins that are expensive, and there's some, so you kind of have to be careful. Those are probably the ones that I kind of go to just because they're easy to find. When it comes to supplements, there's a lot of great supplements. I have my top 5 list, but the reality is that I don't really bring up supplements unless there is a specific reason that I'm recommending it. So it's really hard to say that outside of a multivitamin right here.
Okay. What is a recommended cooking oil?
So that's a really good question. So if you're doing something like a soup, or you're putting something on a salad, or you're cooking at low temperatures, say you're going to cook something at 275 or less, then olive oil is fine, and it's actually a really good one. If you're going to be cooking in higher, I recommend more of the saturated types of fats, like, well, and they're not all saturated. Coconut oil is a saturated fat, but is a medium chain triglyceride, so that's a good one. You also can do avocado. Avocado oil does have a higher point of heat, so it doesn't kind of change that trans as easily. And so does peanut oil. And I don't really recommend the peanut oil as hot as much. It's not as anti-inflammatory as the avocado or the coconut. But you definitely want to be looking at something that is more in the higher heat index range if you're going to be cooking with higher heats.
Can you give us an example of a well-balanced omega-3 dinner?
Yes. So I had a list. I probably should have put it up of about some of the different amounts. Like if you talk about salmon, okay, actually the best way to say it is if you're getting 2 to 3 servings of a healthy fish, and so you're talking salmon, halibut, sea bass, tuna to some degree, sardines, those are all very high. You're not going to get as much in the grass-fed beef or a wild meat or a pasture-raised chicken. You're just not going to get the same amount. But you are going to get some. So to get the best amount, you do need to be eating fish a couple times a week to get that amount without supplementing. And I tell people in my practice they should be getting 2 to 3 servings of a 4-ounce fish, fatty fish, to get the amount if they don't want to supplement. But then you also do get some in your good fats in your and some of the other animal products. So, and also in algae. So if you're having some sushi, then you're going to be getting not just the fish, you're going to be also getting it from the algae. But a good one with omega-3s, I would say, would be an avocado with 4 ounces of halibut, because I don't like salmon, so I'm going to say halibut, but salmon if you like it. And then, a fruit, honestly. You could do an avocado, you could do, you can cook a vegetable lightly with some olive oil, and that's going to give you some of your alpha-linoleic acids. So, I mean, probably something that has 2 or 3 servings with some extra fats, and then maybe an avocado and a good, like about a 4-ounce serving of fish is probably one of your highest in omega-3s.
Okay, now I'm hungry. That sounds delicious. Is gluten-free healthier?
So gluten-free is healthier for some people. When we talk about gluten, it goes back to the fact that no grains are absolutely necessary in our diet. And there is about 40% of people who have 1 or 2 genes that cause them to react to gluten, even if they are not celiac. So celiac is when it gets to the point where it becomes an autoimmune disease. So that's a really hard question to answer. For example, I do have the gluten gene, so I choose to be gluten free completely for the most part. And I only have 1 copy, but my daughter doesn't have it. And so I don't stop her from having it from time to time, but I don't think that grains are absolutely necessary. So I think in moderation, if you do not have the gluten gene, then you are fine.
Okay. Does dairy cause inflammation, and what type of milk should I be drinking?
So that's a really good question. I don't know if I know the whole answer to that. They actually did do a study that showed that whole fat milk was less inflammatory because it did not destabilize the carbohydrates in the milk from the fat in the milk. So they did find that things that were lower, that they did take the milk out of to be higher inflammation. I think dairy is one of those things that just has to be more in moderation as well. For example, I remember doing this acid alkaline diet, which was really interesting, and milk is something that is more acidifying to the body. So it does cause some, but if you're doing that in moderation and you're not drinking, a glass of milk several times a day, doing tons of dairy, that kind of, or tons of cheese, then I don't think it's really horrible for you. I do think that there are some links to higher amounts of dairy to cancer. There's also links to higher amounts of dairy with other inflammatory based diseases. So you just have to, keep that kind of on the lesser side.
Okay. And next question, I'm addicted to sugar. Does this put me at risk of chronic inflammation? How can I break the addiction, and what are the concerns?
So sugar is definitely addicting, and I still go by less than 40 grams of added sugar, meaning the sugar that she's talking about or he's talking about per day. And that's pretty low. I mean, if you think that a soda is 30 grams, a piece of cake is 30 to 50 grams, depending on what you're having and how much you're having. A cookie is 10 grams. So, I mean, a donut is 10 grams. So, I mean, it doesn't take that much to get up to 40 grams. It is definitely an addiction. Dr. Hyman from the kind of the functional medicine realm, he says that sugar is more addicting than cocaine, and probably in our society it is. So I do recommend trying to break that cycle. It's really hard to break that cycle by telling yourself you're only going to eat a certain amount. So a lot of times I tell people to do a sugar-free month where they do no added sugar for a whole month. You will get fatigued, you will get irritable, you will not be a happy person for a couple weeks, but after that couple weeks, it really makes a difference in how you feel. And it also changes how you taste it. So what might have been something that you loved before you did the sugar-free month, suddenly you try it after that month and you're like, wow, that is way too sweet. So I think one of the best ways to break a sugar addiction is to just stop it for a period of time.
Okay, we'll try that. What are your thoughts on intermittent fasting?
So intermittent fasting can actually be really healthy. It can also not be healthy. So a lot of people will try doing intermittent fasting and not really change what they're eating. And so what you're putting in your body isn't really supporting what your body needs. You just might be getting decreased amount of calories, but if your body's nutrient deficient, it's not going to lose weight sufficiently or efficiently. So with intermittent fasting, you have to maintain the same rules, and that is the amount of protein, fats, and carbs that are necessary for your body to function appropriately, and also to make sure that you're getting all those healthy things. So it still has to be a healthy diet, even if you're doing intermittent fasting. But intermittent fasting has been found to be very helpful in issues such as diabetes, and it can be very helpful from an inflammatory perspective if it is a healthy diet when you are eating. I don't really subscribe to diminishing it more than 8 hours a day. And I don't really agree with doing only one meal a day for intermittent fasting. I think that's a bit extreme, but I have played with intermittent fasting and I felt really good on it. And there's a lot of data to back up that it can be healthy if done the right way.
Interesting. Okay. And what are your thoughts on air frying?
On what?
Air
Oh,
frying.
air
Like
frying.
the air fryers. Yeah.
I don't do a lot of it, but it's not like you're doing it. It's not, it kind of depends on um, how hot you're cooking it. So I haven't done a lot of air frying, so I don't know what temperatures it gets up to, but anything over 400 is probably not going to be healthy because anything over 400 can cause proteins to denature, it can cause fats to turn into trans fats and things of that nature. So I think to some degree it probably is just fine. You're not using the oils, but some of the oils are healthy. So then we have to think of that, making sure that you're getting enough fats. So air frying, I'm not 100% sure on air frying, and I think it depends on the temperature that you're using.
Okay. I think that's it. I don't see any other questions coming in. Thank you for sharing all of this information. It was very helpful. We will
Absolutely.
have another seminar coming up in November, and we'll be sure to share that information with everyone who registered tonight.
Thank you for listening.